Hi, my name is Kaylee. I'm going to be doing your physical assessment today. I would wash my hands and then I would provide patient privacy. Can you tell me your first and last name?
Alex Freeman.
And what's your date of birth?
1/1/01.
Where are you at right now?
Home.
What year is it?
2025.
Why are you here?
Physical.
And who's the president?
Trump.
The patient is ANO4, alert and oriented, and his speech is clear. Next, I'm going to be testing your muscle strength, so just push against my hands. All right, go ahead, push against it. And this way. Back. Forward. Go ahead, go down. Go ahead, shrug your shoulders. Good. You squeeze both my fingers. Good. Push down on my hands like a gas pedal. Go up to the sky. Push out. And pull in. Good. So muscle strength is 5 out of 5 bilaterally on a scale of 1 to 5. And the patient's speech was also clear. Next, we're going to test your sensation. So I'm going to touch you with either a sharp object or a dull object with your eyes closed. I'm going to tell me what side it's on, if this is upper, lower, and if you feel soft or dull. Okay, go ahead and close your eyes. Sharp or dull?
Sharp.
And where was it at?
Left arm upper.
Alright. Sharp or dull?
Dull.
What side?
Right arm upper.
Sharp or dull?
Sharp.
And where was it at?
Right arm lower.
Yeah. Sharp or dull?
Dull.
Where was it at?
Left arm lower.
Sharp or dull?
Sharp.
And where was it at?
Left leg upper.
Sharp or dull?
Dull.
Where was it at?
Lower right leg.
Sharp or dull?
Sharp.
Where was it at?
Upper right leg.
And then sharp or dull?
Dull. Lower left leg.
So all sensation was normal. Next, we're going to be testing your deep tendon reflexes. First, we're going to start up with the bicep reflex, and that tests for the C5 and that helps the C5 and C6 nerve root. I'm going to twist around. Go right above anteroral. Right. Next, we're going to flip it up. Sorry. This is right above the elbow, and that is the the tricep deep tendon reflex, and that tests the C7. That's the brachial radialis deep tendon reflex, and that tests C6. Alright, good. That is the quadricep deep tendon reflex, and that tests L4. That test, that's the ankle jerk test, and that tests as 1. Next, we're going to take your foot out. That's testing the Bushinski reflex. So all deep tendon reflexes are intact, including the Bushinski. So next, we're going to test your gait. I'm going to have you stand up. Careful. Go back a little bit. This way. You're going to take 5 steps each way. So go ahead, walk normal, 5 steps that way. Okay, turn around and walk back on your toes. Alright, turn around and walk on your heels. And then come back and walk heel to toe. Alright, you can have a seat again. So the patient's gait is normal, it's steady and uneven without assistance. So next I'm going to shine a bright light into your eyes. Be ready for that. Sorry. Look at this light and follow with your eyes. Very good. So patient's pupils are equal, round, reactive to a light and accommodation. They are about 3 millimeters bilaterally. The sclera is white, the conjunctiva is pink, and there is no drainage. Next, I'm going to just look at the nose. I see no visual deformities. The mucous membranes are moist. I also see no drainage coming from the nose. Next, we're going to move on to the mouth. There's no circumoral cyanosis. Can you look me? There's no cyanosis in the mouth. I see there's no nasal flaring, and I also don't see any pursed lip breathings, which are signs for respiratory distress. Next, we're just going to inspect the neck. So I see no jugular vein dissension. I don't see any accessory muscle use. I'm just going to palpate the carotid arteries one at a time. Sorry, my hands are closed. Okay, so I feel no thrills with that. Next, we're going to auscultate the carotid arteries one at a time. Using the bell. All right. Hold your breath. Go ahead, breathe. Hold your breath. Go ahead, breathe. So I heard no bruise with that. Next, we're going to move on to inspecting overall. So I see no obvious deformities in the chest lung area. I see no barrel chesting. The sternum and the pectoris muscles aren't sticking out and they're not caved in. And I see no obvious signs of shortness of breath, no substernal retractions, no intercostal retractions. Next, we're going to palpate the chest wall, the lung field, 6 on the front and 8 on the back, using the palm of the hand. No abnormalities were found. No abnormal lung sounds were also felt with the palpation. Next, I'm going to auscultate the lung sounds. Go ahead and turn a little bit for me again. And then I'm going to do make sure to lift your arm up for me, each lobe of the lung. Put that arm down for me. I do the same with this. So lung sounds were clear bilaterally on the posterior and anterior side. There was no crackles heard, no wheezing heard, and no rhonchi heard. Next, we're going to move on to inspecting the chest one more time. I don't see any heaving or anything like that. So then we're going to move on to palpating the chest. And we're going to palpate over the valvular areas. So on the right second intercostal will be the aortic valve. The left second intercostal is the pulmonic valve. That third left intercostal is Erb's point, where S2 is loudest. The fourth intercostal is I'm blanking, sorry. It is the tricuspid valve. And the fifth midclavicular intercostal is the mitral valve, and that's where you hear the apical pulse. When you want to get the apical heart rate, you have to listen there for a full minute. All right. No abnormalities were found there. Next, no like odd feelings, nothing like that. Next, we're gonna listen to auscultating all the valvular areas. So S1 and S2 can be heard at all the sounds. There was no heart murmurs heard, and the rate was regular. So after that, we're going to move on to the cap refill. So let me see both fingers. I'm gonna turn them over for me. So the cap refill bilaterally were less than 2 seconds, and it was brisk, which is normal. After that, we're going to check for edema. So we're just feeling. And there is no edema anywhere, which is normal within defined limits. Next, we're going to move on to checking the temperature of the body. You also want to make sure you're checking the hands and feet because those extremities are usually what feels cool. So the body temperature is warm all over, there's no cyanosis noted, and no coolness or anything like that. After we check the temperature, we're gonna move on to the abdomen. So I'm just gonna look at it first. Make that a little bit. All right, so abdomen is round, concave. Normally they wouldn't have a shirt on for this, but I don't see any scars, no abnormal bruising. There's no vein engorgement near the umbilical area. And there's no obvious signs like looking with overactive bowel sounds. After you inspect, you flip it for the abdomen and you auscultate before you palpate. So I'm just gonna listen to all 4 quadrants, and normally you would listen for at least 3 minutes in each quadrant, but for this video, I am gonna be a little bit shorter. So the bowel sounds were normal active in all 4 quadrants. Next, we're going to listen to the abdominal aorta, the renal arteries, and the iliac arteries. You would also listen to the femoral arteries, but for this video, I will not be. So no abnormalities were found there. Everything sounded normal. After that, we're going to go to palpating the abdomen. If there was a tender spot, you would start on the opposite side and work your way to the tender spot. So the abdomen is soft and non-tender in all 4 quadrants. We're also going to percuss the abdomen. So everything is also normal there. The one thing I did forget earlier in the video is to check the pulses. So I'm gonna go back and check those now. You usually check them bilaterally at each point. So I'm gonna start with the brachial arteries, check the brachial pulses. And then the radials. Each leg, the popliteal behind the knee. And then the posterior tibialis. And the pedal pulses. So the pulses bilaterally are equal and strong. And that concludes our physical assessment.